All right, good evening, everyone. This is Mike Cummings, the superintendent of schools in Fairfield. I appreciate everyone being here. We're going to get going. As people join, they will join. Let me give out just some basic operational issues before we get started. Then I'll do some introductions, and then I want to make some opening remarks. First of all, the purpose of tonight's webinar and conversation is to talk about the Fairfield Schools reopening plan for fall of 2020. So we're going to go through many of the questions that were raised in the survey that went out last Friday. We've met this morning in central office, and we went through and identified some themes that emerged from those conversations. From those questions, and each of us in turn is going to take some of them and address them for you. And when we're done with that, we'll turn it over to try to answer as many questions as possible before we end at 8:30. Ms. Colleen Deasy, who is our Executive Director of Human Resources and Legal Services, is going to moderate the chat feature on YouTube and then provide us with the questions as she goes through them. So we'll get to that. While I've introduced Colleen, let me introduce the others who are with us tonight. Joining us tonight is our Executive Director of Operations and Processes, Dr. Zakiyah Parish, Executive Director of Instruction, Curriculum, and Assessment, Dr. James Savachancic, our Executive Director of Finance, Doreen Munsell, our Executive Director of Special Education, Rob Mancusi, our Executive Director of Facilities and Maintenance, Angelos Papageorge. And I'm pausing just for a minute because I want to make sure, given the hour, that I've remembered all of the folks in central office. And also joining us tonight is from the health department, the town health department, Jill Mitchell, who is the nursing supervisor, Sands Cleary, who is the director of the health department, as well as Dr. Henry Yoon, who is the chair of the town of Fairfield Health Committee. Thank you. So they are all with us tonight to answer as many questions as we possibly can. Before we get going, as I said, I just want to make a couple of opening remarks. And if you'll bear with me, one of the things that I want to do here is set some expectations, not only for tonight, but as we go forward into this last month of summer, how we're going to approach the work and our interactions and communications with you. So let me start by saying what you should not expect from us. Let's start at that place. One of the things that's very clear is we are beginning to get quite a number of questions, and I'm sure that the number of questions will increase. And we certainly understand where the number of questions are coming from, because information at times has come very quickly. Changes have come very quickly from the state, and we've been responding to those changes as quickly as possible. So I just want to be clear to you that if you do not get a direct answer from me to all of your questions, I don't want you to think that those are not resonating with us and that we're not looking for answers for them. One of our struggles has been, quite honestly, that we've not been able to provide answers to many of the questions that you've raised because certain things are still unknown. And as more information becomes available, we will certainly share it. But I just want to be clear with you that that all of your questions do matter, and we intend to answer all of them in time. But we have to make sure that our time is spent not just answering questions, but planning for what the new school year is going to bring. The other thing, but I also want to talk about what you should expect from us, and from me in particular. You should expect us to provide you with the honest answers, with the transparent answers. You should expect us to have empathy and sympathy for all the situations and the diverse amount of situations that each of you find yourself in. As I said already, we are going to work as quickly as possible to get you the answers. And as you know, some of those answers are not going to be necessarily things that you want to hear, but they will be the answers that are guiding our decisions. And please know, and most importantly, that as we've, I hope, conveyed throughout the year, we put your health, the health of your children, and the health of our staff first and foremost in our thinking and in our planning and in our decision making. And that factor guides ultimately the decisions we're going to make. A couple other things. Speaking specifically of the plan is not a finished product. I hope that's been made clear to you on multiple occasions. It is a moment in time. It was a moment in time on Friday July 24th, when it was completed around 2:00 in the afternoon. It reflected the work that took place the month before. It changed Monday afternoon at 4:00 at the governor's press conference, when he made the decision that school districts could make some of their own decisions about which opening plan we could utilize. Until that point, it had really been either the in-person or the remote learning. And he introduced on Monday afternoon the idea of the hybrid, which we'll talk about in a little bit. So I just want you to be aware of that as the plan evolves and will continue to evolve, we'll continue to revise it. We've revised it a couple of times already online, and we will continue to do that as we go forward. Another thing, certainly in response to changes from state guidance, the plan is going to evolve, but obviously, and most importantly, the plan will evolve, on changes in the health data that occurs in the town, the state, and to some degree the country. And we will continue to work with the health department around those changes, monitoring those situations, and that will guide our decisions as we go forward. So I want to assure you of these things right at the beginning. To give you some examples of things that in the plan, as we put it out and you react to it, as our administrators and teachers react to it, there are things that are, I'll give you a specific, for example. There was understandable concern around the initial idea around how we would handle food allergies at the elementary level. Based on those concerns, we are looking already at some revisions to that part of the plan, and we will be working with the health department and our staff to make some changes to that as we can moving forward. But certain other aspects of the plan do not change. For example, there is no leeway in the plan generally speaking, around the issue of masks. And we're going to talk about that in a little bit. But masks remain required for the great majority of students and staff in the district. And that is an essential component of the state's expectations for reopening. So there are certain things we can work with and certain things that we cannot work with. Let me talk about the hybrid idea for a minute, because that's been a hot topic in my email even this afternoon. Just really briefly, right now the state guidance on the hybrid is that it is to be considered really only for the high school. I understand just about half an hour ago that we might be getting some further guidance from the state tomorrow about how we could implement that or what might necessitate the implementation of a hybrid model. But at this point, the state is holding back on the idea of hybrid for anything below the high school, primarily because they feel the students' needs are going to be best served if they're in school. I think one of the things that's missing from the plan is we did not have time to really get through and edit all the learning documents that our staff created in the month of July, the very first few weeks of July. We had quite a number of staff working on instructional plans and on curriculum revisions. A lot of that information still has to be edited, cleaned up, and put out for your viewing, but we did not have time to get that. Our priority was on getting the logistics plan. So more information on the learning plans. We can address some of those questions tonight, but even more information will be provided as we get closer to the start of school. The committee who developed the ideas for the plan and the people who wrote it, are educators and parents and community members. Concern for each other's safety, the safety of the children, and their own safety inform their work on the plan and the plan itself. So if the plan format conveys to you a methodical and dispassionate approach to safety and wellness concerns, it really is meant to. It is a compliance document produced for the state. It does not convey the great care that people took when they were making the decisions that went into the plan, the final plan. And the final statement I want to make tonight, before we get going, is this. We are, and I am, very aware of the fear, confusion, anxiety, concern, and even the anger that exists right now in our community. I not only do I feel those emotions personally, as your superintendent, I share every emotion because my job is to protect our students, staff, in this community. That's the number one part of my job. And my job is also to give you all the answers that you request and need. And I can't answer all those questions right now, as I've already stated. We are moving into September, preparing to fulfill the mission of the Fairfield Public Schools as we consider all of the health and safety concerns associated with COVID-19. From the beginning, the health, safety, and well-being of our students, our staff, and this community have guided every decision. It is a new school year, but commitment to health, safety, and well-being has not changed, and it will not change. That commitment will continue to guide our decisions. My expectation for today's meeting is to answer as many questions as possible, and in doing so, hopefully reduce some of your fear, confusion, anxiety, concern, and anger. More importantly, I want you to know that we are listening to you and we are working together towards the best possible answers and solutions. When I leave work tonight and go home, I go home to 5 kids who are expected to go back to school in a month and a wife who's expected to go back to her 5th grade classroom. So this is personal for all of us. And we approach that with you, your kids, and our staff foremost in our thinking. So that ends my beginning. And I'm going to take the first couple of topics, and then, as I said, each of the executive directors and Ms. Mitchell will answer some of the other questions that we identified from your responses over the weekend and the first couple of days this week, and then we will get into your questions. So I'm going to take a couple of the issues. I'm going to first address the issue around social distancing. So again, the social distancing aspects of the plan, we are following the CDC guidelines that were developed. Those guidelines talk about 6 feet when possible. We understand the concern. People have heard that 6-foot number since February, and we understand that becomes a really difficult metric to meet in our classrooms. So we are working with the idea of 6 feet whenever possible. Certainly, that's going to be something we're going to be able to do a better job maintaining in the hallways, in shared spaces, and outside from students. But in the class, we are looking at students no closer than 3 feet all the time, as I say, with masks. And we'll talk about masks and face shields and other face coverings in a few minutes. We are going to, and Mr. Papageorge will speak too later about how we are going to maintain those distances in our hallways and those other spaces. We are going to be working with the teachers to start the school year on, we're going to get them involved in helping to determine how the classrooms will be set up so that they find the balance between a good learning environment, but also those social distancing expectations. The other issue I want to talk about is cohorting. As we've talked about in the plan, cohorting is a lot simpler at the elementary school, and it becomes more complex as students get older. In fact, it's a very, very difficult thing to do at the high school, if at all. But students will be in multiple cohorts, so I want to be clear about that. And our job really essentially is to reduce those numbers of cohorts as much as possible. At an elementary school, the students in a classroom are clearly a cohort. Students who take a bus, that will be a second cohort. We are looking to minimize movement in the schools to reduce the cohorts intermingling as much as possible. That's why lunch will be served in the classroom. That's why our specialist teachers will be traveling to classrooms wherever possible. That's why at the middle school on teams, teachers will travel to the students on team, not students traveling among the team. Middle school students, however, will probably still go out to family and consumer science and tech ed classrooms and things like that. Because those are unique learning spaces and they should be addressed. But as much as possible, we're going to reduce movement. We're going to reduce the number of cohorts. Our survey showed that about 20% of our parents, at this point anyway, intended to keep their students home for remote learning. So that will reduce the amount of students in the building. And about 50% of our parents indicated a desire to drive their children back and forth to school. So that will reduce the number of students on buses. In the plan, as you notice, the state has also put those metrics in. They haven't yet identified the metrics, excuse me, but they have identified the idea of in-person, hybrid, and remote learning, with the idea that health data will determine if we have to further reduce the number of students in classes or on the buses and in other spaces. So, as I said, we may be getting more information on that tomorrow from the state. We will be working in the next month in the survey. You got my email hopefully this afternoon. We're going to hold off a week on the survey, but we will be collecting information to help further guide the cohort development in the last couple of weeks of August. So I think that ends the couple things I wanted to talk about with social distancing and cohort. So Ms. Mitchell, would you mind speaking to the issues on your sheet there?
Of course.
Thank you.
Thank you. Thank you, Mike. I'm Jill Mitchell. I'm the nursing supervisor for the town of Fairfield. I want to talk to you about certain health issues that were raised in a number of your questions that were submitted. Before I begin that, though, I want to just let you know where our background is coming from. All of the contributions that I have made to this plan are done in consultation with the guidelines from the CDC and the State Department of Health. I've also worked very closely with my director, Dr. Sands Cleary, and have gotten consultation from Dr. Henry Yoon, the director of our Board of Health, and from Dr. Bruce McDonald, who is the town medical advisor. Now, having said that, Mike has asked me to address three of major health issues that were in your questions. The first was, what happens when there's a positive test? And that can occur in one of two scenarios. The first is if we get a report of a child with a positive test or a staff member. We're going to be asking parents and staff members to contact the school nurse and the principal to notify them of the positive test. When that occurs, we kind of put our plan into place, which is in one of the appendices in the plan. Let me see. We're going to have the principal and the school nurse identify the close contacts in the cohort, as Mike described. And that could include at the elementary level, the children in the direct classroom, as well as on the bus. As he said, in the high school level, it's a little bit more complicated, but we will do our best to identify those close contacts. I will notify the health department, who will activate our plan there, which is to use the staff in doing direct contact notification of those people who are close contacts. We will also speak with the identified patient and review isolation guidelines with them. The close contacts will be advised to quarantine, and these are all very specific guidelines from the CDC that we'll be following. The other scenario that would occur is if the individual is in the building when we get notice of a positive contact. Either, the teacher receives the positive report on her phone, or the student is notified, or the parent notifies us that the student who's in school is a positive case. Hopefully that won't happen too often, because these patients will presumably, if they are symptomatic, will be home with their illnesses. But in the event that does happen, we're going to ask that the individual isolate in the various isolation rooms that have been identified in each one of the schools in town. We have those in place. The actual isolation rooms themselves have yet to be approved by the administrative committee, but we hope to get that up and running, and we will. So once that happens, we're just going to follow the specific guidelines that the CDC has in terms of when the person can return to school, who needs to be quarantined, and just use those guidelines going forward. The other question that Mike asked me to address were the screening procedures that we are considering. Right now in the summer school setting, we are using in-person screening at the school itself when the children arrive. We've given out COVID screening lists to parents, and they complete those forms prior to their arrival at school, and we do temperature checks upon entrance. It's been working well, but the numbers at the extended school year program are very low. Only about 50 or so children are in the program. This would not be a feasible process if we were to do at-school screening in the fall. What we are going to do is ask parents to do the screening. And I have to say, this is all part of our responsibility to, be in this together and work with us together. The CDC has recently come out with a modified screening checklist The State Department of Health has not reviewed or has not approved that yet, I should say. But I'm sure that we will be using some form of that for parents to use at home every day before they send their child to school. Parents know their children better than anyone. And if things do not appear well, or if they are in any way sick, or if they have a temperature, they must remain home. So that is what we're doing. Let me see. My thing is that I really want to encourage parents to integrate this into their whole morning routine. That, we are in a pandemic, and we do need to incorporate some of these new practices in what we do. The last thing that Mike wanted me to talk about was food allergies, and he alluded to that in his introduction. As it is right now, the elementary schools at least will be eating in the classrooms. And the plan as it is written now says that the student with a food allergy can choose a buddy and the two of them can go to the cafeteria and eat their lunch. We may be revising that. We do have to maintain our, really adhere to the tenets in the food allergy policy that we have in terms of no peanuts and tree nuts in the classroom. Children in the elementary school right now, as you know, are allowed to have a snack in the classroom, but certainly cannot contain peanuts or tree nuts. We may need to extend that policy so that no food in the classroom for lunch, otherwise snack, whatever it is, contains peanuts or tree nuts. But we'll be working on that going forward, and I look forward to getting parent input in that regard. There are other modifications that we could do for the food allergy issue. The nurse certainly has a list of what students in any one particular cohort has a food allergy. We could make recommendations to that particular class not to bring in any allergens of that sort in their lunches. We might be looking into different space options to serve lunch so that we can socially distance at a more reasonable level while maintaining the safety of those students who have food allergies. So that's all for now, but I'm sure there are going to be many, many more questions going forward for my department. I encourage your questions and, on today's webinar, but you can certainly always contact me through the health department as well. And I have Sans Cleary here. Sans, I don't know if you wanted to add anything now to that, what I've said.
No, I think you covered all the issues that we were asked to address in that. I think it's as you said, it's a collaborative effort with the health department and the Fairfield Public Schools working together, along with our chairman of our Board of Health, Henry Yoon, and also with Dr. McDonald. So we're working to provide all the best, most relevant, most recent information. We're participating in CDC and State Department of Public Health conference calls, along with conferences for school medical advisors that they had just the other day. And so we're trying to get all the latest information and incorporate that into the plans and get it to the groups that are working on those plans. And so, I appreciate all the efforts of everybody on the call.
Thanks. Next up is Zakiyah Parish, and Zakiyah will discuss the mask policy for the schools. Thank you.
Dr. Parish, before you begin, I'm sorry, if I can just make a quick comment, since we're talking about health. Thank you. So I just want to make it very clear, and I feel a little silly having to say this, but I want to make it very clear that from the health department and I'm sure from the Board of Education's perspective that obviously education here is the priority, but we recognize that it's not at the cost of the safety for your children, for our students, for my children. And that is clearly number one in terms of what we're thinking about. As you can all imagine, and I'm sure everyone here can attest to, the fact that trying to educate students is a challenge in and of itself. And then to try to do this under these circumstances in this environment is just exponentially more difficult. I want to share the idea that as much as we'd like to, we can't eliminate all the risk. And so one of our focuses, at least from the health department perspective, is how do we go about reducing as much risk as possible? How is it that we mitigate the risk as much as possible? Because we recognize that compromise is unacceptable, right? We're not here to compromise people's safety and compromise people's education. We want to make things work, right? And certainly we're not going to have all the answers. I see here on the chat that people have already commented on, giving kudos to the Board of Education, and I've got to add my kudos to that as well, under the circumstances. I'm working here. I feel honored to be able to work here with the Fairfield Board of Education. I'm doing something very similarly in Stanford, with my role in Stanford, as well as with a number of the universities here in Fairfield as well. And I can tell you that Fairfield has stepped up. They have clearly been a leader in terms of making this work. And so, again, not to ramble on, but I do just want to be able to say that we're going to make this work. I'm confident, and I've seen it with a number of different organizations, a number of different institutions, and Fairfield is clearly a leader in terms of implementing change and implementing programs that really take our students, our children, into account. And so thank all of the parents and all the teachers and all the administrators for really putting the time and effort into doing this. And we cannot do this alone. Our collective minds and our collective ideas. I apologize, I'm a bit distracted by the chat room, because there's already so many good ideas and so many good questions coming through. And so please keep it up. I know from the Board of Health perspective, we welcome ideas, we welcome suggestions, because that's where the answers are going to come from. So I'll just stop there. I apologize for rambling.
Thank you, Dr. Yoon. I am Zakiyah Parish, the Executive Director of Operation and Processes. So I'm going to address some of the questions that have been raised in reference to masks and face coverings. First thing to note is an acceptable face covering is a mask or a covering that completely covers the nose and the mouth. And they must be worn by everyone, staff and students, when inside of the building or on buses. Part of our efforts is to make sure that we have extra masks available as backups for any staff or students who might need one. But we are asking parents to ensure that you provide your child with a clean mask every day, and that they are trained to start wearing those masks as soon as they get on the bus. Like, that's the thing that they need to do when getting on the bus. They need to have the mask on. The drivers will have masks on, as well as the bus monitors. And they will have masks available in the event a student forgot their mask at home or just didn't have one that particular day. But we are asking parents to be partners with us in making sure we minimize the risk of exposure by ensuring that your child has a mask every day, and that if they are taking the bus transportation, that they have it on beginning at the point where they enter the bus. There will be mask breaks throughout the day. There are at least 2 that are being scheduled by building principals, one in the morning and one in the afternoon. But as needed, the teachers can, take a pulse within the room and determine whether or not there is a need for additional mask breaks. And some of the things that we're encouraging, especially while we have really nice weather out, is for them to just take a walk outside and be able to, socially distance, but also get some fresh air without the restraint of a mask. So those breaks will be done as needed or as scheduled by the building principal. As we mentioned, we are encouraging and strongly recommending, not even encouraging, we are requesting and requiring that all students have masks on. And in the event, there are students that are refusing to wear their mask, depending on their age and what's developmentally appropriate, that will determine the way in which we handle that situation. For some students, they may have a behavior plan that requires us to follow the steps within the plan. Of course, parents will be brought into the loop and contacted so that, again, as a partner, you can work with us to get your child to again, resume wearing the mask. And if needed, it would go up through a traditional disciplinary procedure, but that's only when it is appropriate and when necessary. We recognize that there are some rooms in buildings that are not air conditioned. So In the event there is a need for it, we are working with the health department to develop a heat protocol. And this heat protocol will allow us to determine when it's necessary to call for early dismissals based on what the weather is predicting in terms of temperatures. And it also may be necessary, as I mentioned before, for teachers to determine that it's needed to have more frequent mask breaks, depending on the temperature in the room. But that heat protocol will ultimately aid us in determining whether or not it's safe to continue to have a full day of school, or whether it's necessary to end the day early. In terms of mask use outside of the traditional classroom setting during instruction, during lunch, of course, students will remove their masks to eat lunch. During physical education, they will remove their masks because they might be doing some strenuous exercises. And that, will again be at the discretion of the teacher. There are times when they might not do activities that require as much exertion. And so they may deem that it's appropriate for the kids to continue wearing their masks during physical education. But in most instances, they will be removing those masks in order to participate in the activities during PE. And then during recess, masks will be worn at this time according to the recommendations from the CDC. Again, those are ever changing, but at this point in time, it is recommended that students keep their masks on during that recess period. I mentioned earlier that masks are required by all. There are some exceptions to that rule. And so we're actually going to have Executive Director Rob Mancusi talk about some of those exemptions and what they mean in terms of the protection and safety of our staff and students. Rob?
Thank you, Dr. Parish. And hello, everybody. This is Rob Mancusi. I'm the Executive Director of Special Education and Special Programs. As Dr. Parish mentioned, there are some times or exemptions where students do not have to wear masks. One of them being in certain cases, when a student is receiving speech therapy, it may not be appropriate for the student to wear masks. In those cases, we are implementing additional mitigation strategies. We are going to be purchasing clear face masks for the students who are able to wear face masks, and the therapist as well, so you can still see the person's lips and the person's mouth. We are going to have clear face shields as well for staff and students to be able to access, as well as clear plexiglass barriers to utilize between the therapist and the student. And we're going to use social distancing as to the greatest extent possible when we're talking about working with students with significant disabilities. There are on pages, for those of you who want to refer back to the Advance, Adapt, and Achieve State document that we refer to on pages 20 and 21, there is, the official guidance from the state in terms of mask exceptions when you're working with students with disabilities. Some of the criteria for those exceptions are if a student has trouble breathing with a mask on, they're exempt from wearing the mask. If the student or anyone who is unconscious, incapacitated, or unable to remove the mask without assistance, they'll be exempt. Anyone with a medical reason making it unsafe to wear a mask or face covering will be exempt. And for students while they're eating during PE or while they're drinking, and then specific situations as determined appropriate by the school-based team and the families. I will also say, give a special thank you and a shout out to the Fairfield Public Health Department for all their guidance and support to the public schools in terms of guidance that we release out in our plans. And without their support, it would not have been possible to be able to offer a small group of students, our most impacted students with disabilities, live OT, PT, speech and behavioral consultation this summer. Surprisingly, it's pleasantly, I'm able to report that, our students who are participating in our live related services this summer, they are, for the most part, able to keep their masks on with some coaching and assistance, but we are pleasantly surprised that with the level of mask wearing that students have been able to demonstrate. Part of, I think, helping parents and families with that is preparing students prior to returning to school or prior to returning to ESY. The health department provided us with some materials such as social stories and a mask video that families and students were able to watch. So those are some of the things that we will do to support families, to support students in preparing them for wearing masks when they come to school. I will now hand it off to my colleague, Angeles Papageorge, Executive Director of Maintenance, to discuss cleaning protocols.
Good evening, everyone. I was asked to talk this evening about the cleaning protocols, the safety and security of the buildings, and the ventilation systems. So starting with the cleaning protocols, we just want to make it clear that we are going to be adjusting custodial schedules. So we have additional custodial staff in the buildings during the day when the students are there to keep a rotating schedule to maintain the cleanliness and disinfecting of the buildings. A question that came in was specific to elementary school and eating in the classrooms. We've adjusted schedules so that the custodians can come in when the kids finish eating and go out to recess to remove all the garbage for food garbage and also disinfect and clean the desks in the classroom. In addition to that, we've also made arrangements for the custodials to receive extra training from some of our vendors on specific COVID disinfecting and cleaning. And also, we are working with our maintenance and custodial staff to make the hallways in the buildings more of a one-way flow to avoid cross-contamination with the hallways. They're going to take on the appearance more of your commercial establishments in town, with almost like your grocery stores with one-way hallways wherever possible. And if not possible, then we will make it so that the hallways are identified and divided for one-way use on them. See. So that's it for cleaning. I'll move on to safety and security. People have asked about fire drills and lockdown procedures. We're currently working with the State Department of Public Safety, which is a division of Homeland Security, Region 1, which is where we are a member of. We're working with them to figure out the best protocols and procedures to keep the kids safe and how to run drills for safety, but also to keep the kids healthy at the same time. So we will be releasing protocols to staff in the buildings for the best practices of that once they're released to us. For ventilation, that's been the big question. We've contracted with multiple engineers to work on our buildings to look at the types of ventilation systems we have, what types of cooling and heating systems we have to figure out the best practices for that. I know the state had released guidelines about opening dampers 100% and turning off economizers. We recognize that that is an option, but it's not necessarily the best option given our buildings and some of the age of our buildings. So we are working with engineers to figure out the best way to bring fresh air into the buildings and have the most fresh air as possible. I know the state requires a 15 CFM return for each person in a classroom. So that would be our minimum standard, but we're working to move above that. The last thing I will mention real quick is we're working on filter changes. The district has always used a standard filter for HVAC systems. We're currently working with our vendors to up the filters from a MERV 8, which is what we normally use, to somewhere in the range of 11 or 13, which is a greater filter and works better with removing air particles. I think I'll end there just in a matter of time so we can get as many questions in as we can from you. Oh, I'm sorry. I'm turning it over to Executive Director James. I'm sorry. I'm not going to try to pronounce your last name.
No worries. Thank you all. This is James Evajancic, Executive Director of Instruction, Curriculum, and Assessment. And thank you all for coming this evening and both supporting our plan and being involved in our plan to make it better to reopen the schools in the new year. I have a few topics here to discuss about the academic piece of the plan. As Mr. Cummings had mentioned earlier in the webinar, we are still nailing down some of the specifics at each level of what it would look like in terms of timeframes and curriculum development. But many of the questions that did come about from the scenarios, and remember there's 3 at this point: full in-person learning, a hybrid plan, and an option for remote learning. You know, some of the questions that came about are things like, will I be able to Zoom or join the class from home while it's going on? And at this point, that is not the case. There is an in-class assignment, obviously, and a remote assignment, but they are different than what's happening in the actual classroom there. The other question that came up a lot is about the classroom teacher. If you, for example, join the class in person in September and then decide that it might not be right for you or your family and you go to remote instruction, it is most likely going to be a classroom switch in remote to a different teacher to accommodate the different levels of the plan as well. We are requesting that families provide about a 10 instructional day limit if you are planning on changing scenarios from in-person to remote or from remote to in-person. Obviously, if a student is expected to be quarantined or cannot come back to school for an extended period of time due to illness or family illness, we would expedite that process. All of our building principals and teachers and program directors are working pretty hard on, developing master schedules and what the school day will look like. As was alluded to before, we will be limiting to the greatest extent possible student movement throughout the buildings, which means that teachers will most likely travel to your students versus traveling to them. But within the plan, there's also some very specifics in some disciplines. For example, in some of our music classes, there is the expectation that the social distancing spacing is 12 feet versus the expected amounts in other rooms. All of these plans will obviously, as you're probably thinking, will have an effect on our curriculum rollout, our pacing, our assessment for students, and obviously the instructional practices that come along with all that. School is going to look a little bit differently than it has in the past years. Another example of that might be groups of students can't necessarily meet in the back of rooms with teachers anymore in close quarters. There'll be more digital grouping going on, which leads to questions that were submitted about device uses. And our technology department has been working to be able to deploy those in the beginning of the year as appropriate, so that students have access both to teachers, groups, and curriculum digitally. We've also thought about all of those shared materials students use throughout the school day. For example, in elementary schools, there's math manipulatives that are frequently touched and shared among students, or book bins, for example. And we are devising plans to come up with individual sort of bags that go with students so that there's not sharing among groups or among classrooms with that. Same thing for art supplies and so forth. So like we said, there'll be forthcoming plans in the near future when we have more specifics about each of the 3 scenarios and how they'll look at the 3 levels: elementary, middle, and high school. And we look forward to obviously your questions and collaboration on that as we move forward. I'm going to turn the next portion of this webinar over to Ms. Deasy, our Executive Director of Human Resources and Legal Services.
Thank you. I'm Colleen Deasy. Good evening, everyone. I am the Executive Director of HR and Legal Services. My update for all of you is very brief, and then I will turn it over to the questions, and we'll start to try to get through as many of those as we can in about 45 minutes. My update is only that we will continue to be following the state's quarantine expectations for both staff, and we will expect that students and families are going to continue to follow that as well. That applies for both families traveling out of state and then families hosting visitors from the out of state areas that are on the current quarantine list. So our expectation will be that if a family member does travel, which at this point in the summer, people still do have travel plans, they will need to quarantine for 14 days, and that will include not attending school during that time for the student. Okay, so for questions, let me pull up my list here. Mike, we had a couple hundred people join after we started, and I think that some of them might have missed some of the framework for this discussion, so it might be helpful if we revisit. One main question is, what are the parameters going to be about when we decide that we need to do a full closure or close a partial closure? How does that decision-making work? And then how did the decision-making work around hybrid being only for high school at this point?
Okay, so thank you. The word has been at the beginning that the state was going to provide us with metrics related to health data that would essentially trigger the change from an in-person model to a hybrid model, or from a hybrid model to full remote learning for all. As I said at the very beginning, I've heard, can't confirm this at this point, that we might be getting that information tomorrow. And as I said at the beginning, we had been planning, based on the state guidance, that essentially what we would do is offer parents an option of either in-person 5-day a week or the remote learning option to start the year. That's what the state guidance was. On Monday, that changed when the governor introduced the idea of a third option, the hybrid learning. The hybrid learning had been, until that point, part of this health data progression. Now he's raised it as a possibility to put forth from the very beginning of the year. And it does not at this point. And I say this, I apologize for kind of holding back on definitive answers here, because a lot of this is still not clear, but it does not appear now tied to the health data. It appears to be something that towns can consider as an option to start the year, no matter the health data. The guidance in that conversation, this was part of his press conference on Monday night, was, and the Commissioner of Education, Miguel Cardona, was part of that as well, was that their conversation was about high school. And this issue was driven by districts in the state with large high school settings, school districts like Danbury and Greenwich, and their inability to appropriately social distance in those contexts, in those buildings. So they are talking about it really only as a high school option at this point. There is a great concern, and there has been a great concern stated by the commissioner, I think, and we all feel this as educators and as parents, that the students who struggled the most in remote learning were the youngest students, and special education students who required additional services. So the hope is for the state that if the health data allows it, those are the students who still should be in school as much as possible, unless their parents elect to have them not be in school. That we know from all our own experiences as parents and as learners ourselves, that window of opportunity that happens in pre-K to grade 3 is only comes really once. That's when kids really do learn to read and to put together those basic skills as the foundation pieces for all the rest of their learning. So that, I think, is what's driving the state expectation. A number of you email me, and I've been clear, I hope, in my response, that this is like everything we're going to say, this is the information as of today, July 29th. If it changes, we'll let you know as soon as it does. If we have further information on what drives those changes, we will let you know as soon as we have it. So that's where we are right now with that.
Thank you. So the next major theme that emerged in the comments was around what distance learning is going to look like. I think what I'm seeing as a theme is, if there's not an opportunity to join into an existing class via Zoom, what does the instruction look like for distance learning? And I think that this will need to be addressed by James, Zakiyah, Mike, and probably Rob as well. Is there more specific information that we can give to parents at this time? If a student opts into distance learning, are they still a part of their home school or their home classroom, or how is the class assignment going to be made? I think, and I can if you guys want to start talking about this broadly, I can follow up with some of the more specific questions that I've seen as well.
I'll start, and then either James or Zakiyah, Rob, you can follow me on this. I'll try to approach this in broad strokes. We do owe you more information on this. Our teachers have compiled lengthy documents. I will tell you, they are lengthy documents at each level, K2, 3, 5, 6, 8, and 9, 12, around what blended learning, that's what we're calling this approach, will look like. I would say in a large way, it's about finding the balance between this idea of learning together and students' independent learning, and how we're going to appropriate that. We took the survey data that you compiled in May around the remote learning experiences, distance learning experiences that you had as parents and your children had as students, and we went through that information very carefully. We shared it with all of the educators at every level. And we identified, and we had parents who volunteered to go through that data for us, identified major themes and correction points, and we used that information to develop the learning plans for distance learning. So issues around communication, that was a sticking point for many, the issues around live video, that was a sticking point for many, the issues around material supplies and all those types of things we've attempted to address going forward. It was also our expectation, and quite honestly, we really have been planning with the idea that some type of distance learning for all will take place during the school year. I believe I started communicating that concern to you way back in the spring, based on projections from health departments. So we went forward with the idea that our major task this summer was to improve the distance learning experience for everybody. And I believe when you see the documents, you will see that. So I don't know if James or Zakiyah, if you want to, Rob, you want to follow up on that at all?
Sure. Some of the specifics for distance learning, and the state has provided some guidance in the past few days that it won't necessarily look like live instruction from, the school hours, 9 to 3, or whatever they might be for your homeschool, and that the ratios between obviously live instruction and live instruction in the classroom and what you're expecting at home will not be the same as well. For example, if there's a 90-minute literacy block, there would not be an expectation of a 90-minute live lesson every single day as well. There's two areas we toss around frequently in the idea of distance learning, which is synchronous and asynchronous learning, which is the live stuff for synchronous, the small group work, the one-to-one work, as well as the emails and the communications that are happening in real time, versus the assignments and projects and long-term assignments that are given that are more asynchronous in nature. I know Colleen said there were other questions about homeschool assignments, and obviously residential district boundaries would still apply. However, teachers might be distributed across the Fairfield schools if you are in remote learning. So you may have a teacher that is teaching remote for 5th graders in multiple schools in terms of grouping, and that's still to be determined when we get more data to emerge on how many students are requesting remote learning versus in-person learning for that. Zakiyah, I don't know if you have anything to add, or Rob?
Yes, actually, I do. I just wanted to let parents know in reference to one of the parts of the question that Colleen shared with us, is that students will be assigned to their school. So if I'm a student at Burr, I will still be logged as a student at Burr and Infinite Campus. However, I will also, if my parents have opted into remote learning for me, I will also be a part of this. I will also be identified as a part of this remote learning academy. And so what that means is that it's similar to basically what James said, is when you are assigned a teacher, it may not be a teacher at Burr. It may be a teacher that, if I'm in the 3rd grade, is a teacher that's teaching several students in the remote learning academy across the district at Burr. And if my parents do decide to opt back into the in-person learning model, just understanding that you won't necessarily be assigned the teacher that you may have been assigned if you were initially an in-person, changed your mind at some point to remote, and then opted to come back. We are also asking that parents give us at least 10 instructional days to make those changes. It's important for us to be able to do that, particularly when you're talking about making the switch from in-person or from remote back to in-person, just so that we can make sure that the distribution of students within the different cohorts are equal, and that we can accommodate the added students and make sure that we have enough social distancing provisions for any added students. And that will allow us to be able to do that over that 10-day instructional day period. So we do ask for that time to be able to ensure not only the safety of your child now being introduced to this cohort, but the safety of the cohort and the staff working with that cohort as well.
Hi again, this is Rob Mancusi. If I could just speak to this question briefly on behalf of students with disabilities, I will say from March to June, throughout the spring, it's probably the single most discussed topic that I've had with parents, and I continue to have with parents regarding remote learning, is the live face-to-face time students spend with their teachers. And that could be working on specific academic needs related to goals and objectives, as well as, you know, social emotional needs related to IEP goals. I think it's almost unanimous that the parents I spoke to reported that when students were able to interact live and get live instruction or live interaction with their teachers or their service providers, the students were more engaged, and they, you know, the family was more engaged, and the benefits were great. So moving forward, we have not been granted any waivers to our IDA requirements regarding implementation of IEP services. Federal law does allow flexibility in determining how to deliver special ed services to students. So obviously there will be ongoing discussion with families depending on whether a student is receiving services live, which is what we're hoping for, to deliver services live to the greatest extent possible, or remotely. But it has not, it's not lost on us that students with disabilities benefit the greatest when they can have live interaction with their teachers, whether that is in person or whether that is remote.
You know, Colleen, before you jump in, one thing I may have left out in a lot of the parent surveys, there was a question of consistency in remote or distance learning, and that's something, you know, we're all working on in terms of providing a, you know, a coherent set of curriculum to those students who opt for distance learning, in terms of communicating to them both regularly and consistently, and as well as having a long-term plan so that things aren't posted on the day of, and that we know, you know, kids and parents know how to plan their weeks and, you know, as far in advance as possible and months out moving forward. So we are planning for that as well, which came through as an emerging theme in the surveys.
Yeah. James, the follow-up to that is what PD has been done is being planned for staff around distance learning to support our staff in doing that work.
Sure. So as you know, Mr. Cummings had mentioned, there's been an enormous amount of work looking at both blended situations, in person and at distance learning. And you know, quite frankly, a lot of the practices in the blended environment can easily translate to distance learning or the in-person environment, which can, you know, hone the skills of distance learning. We have identified at this point, I should say our teachers have identified at this point, a list of areas that require professional learning. At this point, we've compiled them, and we have to look at them by level and by department in terms of what needs to be deployed prior to September to make sure that the plans are obviously appropriate with it.
Thank you. And then, Mike, there's a lot of confusion in the chat around why we aren't just having students Zoom into a class that's happening. What is the holdup in doing that? Why aren't we just doing that as our plan?
That would be an easy thing to do, and it's tempting. I cannot justify it from an educational point of view. I think for having students sit in a classroom, you think there would be their 6-hour day on a screen. It is not recommended educational practice. In fact, as Dr. Zakiyah spoke about, the state has really made clear that when students are working at home through the use of technology, they need to take breaks. They need to engage in more independent learning. They should not be on screens like that. When you're in a classroom environment, the teacher constructs lessons that ideally are going to involve student movement through the classroom, student interactions. Even when with our limited around social distancing, they are going to be together. That does not translate into a group of students who are essentially appearing on a computer screen, or a teacher who's appearing on a computer screen in their homes. So I cannot, from an educational point of view, we as a district cannot support that. We don't think it's going to be good for kids.
Thank you. This next question, I think we'll need to go to Zakiyah. It's about students who choose to do remote learning, and especially older students, and how that will impact activities or extracurriculars. So what is that going to look like? Is there going to be an option for extracurriculars for students who are doing distance learning? Can you talk about that a little bit?
So at this time, students who are opted and their parents who opt into the remote learning program will not be able to participate in after-school in-person activities. If there are clubs and groups that meet virtually, they are absolutely welcome to join in with those particular groups and clubs. But to introduce a student who is staying home because of a need that their parents have made a decision that it is in their best interest for them to not be a part of in-person learning, to then come to after-school programming would expose them to the same concerns that they would have been exposed if they had been in school in the in-person learning situation. So we are asking parents to make that decision based on the fact that if they do opt into remote learning, that their after-school involvement would be limited to just those clubs and activities that met virtually, and not those that actually met in person, inclusive of athletics.
Thank you. I have a series of questions for Mr. Mancusi, if you are ready, Rob. You're on mute, though.
I'm ready.
Okay.
Thank you.
Can you talk about how PPT meetings will work for parents to participate in them?
Right now, we're continuing to plan to hold PPTs virtually.
Okay. Thank you. And I think that you will not be surprised to hear that there's still some concern about students with special needs who their parents do not believe that they will be able to tolerate face coverings in schools. Can you talk about what the plan is for that?
In terms of the specifics for students, we reviewed some of the additional mitigating strategies for dealing with students or working with students and families who have difficulty wearing face masks. We will continue to consult with the health department on this, as well as work with the school and the families. And if need be, our BCBAs to develop some protocols to kind of reinforce students who to wear masks. It is going to be a challenge for some students. It's not going to be easy, but it is something that we will work with individually with each family of students who do have difficulties in this area.
Thank you. Rob, would you mind, while I have you, would you mind talking about some of the social emotional considerations?
Yes, I would
Went
be
into
very
the development of the plan.
I would be very happy to talk about the SEL part of the plan. One of the primary focuses of the state plan, or the priorities, I should say, is, social emotional learning for students. There's no secret that this extended closure, this pandemic has taken a toll on not only students and families, but staff. What we are doing, there's a couple things. We've developed a Fairfield Public Schools re-engagement plan to re-engage all families within the educational process, and to identify those families or those students who had the most difficulty engaging during, the extended school closure. One of the things we're going to implement is, and one of the areas of focus is going to be, trauma informed care. We're going to do a screening, develop a short universal screening for students to identify the level or the degree which they have been traumatized by this pandemic. A lot of students have experienced, and a lot of families and a lot of staff for that matter have experienced heightened anxiety, feelings of isolation, and other emotions that that get in the way of educational progress and performance. So what we will do is we're going to work with each of the schools to set a date for when we want our screeners to be completed. So we will be able to develop intervention plans to meet the needs of students. Part of the re-engagement plan as well is going to be in identifying the most disengaged students, is to try to hook them up with a mentor, for a lack of a better word. It could be anybody in the school that had the greatest contact or the greatest connection with that student and that family prior to the closure, and to implement strategies to continually engage families. Additionally, we're going to expand upon social emotional learning initiatives that we're currently implementing in the schools, such as Second Step, or such as Mind Up, dialectical behavior therapy, across all levels. And we're looking to expand into some additional supports, such as bringing restorative practices to the Fairfield Public Schools as part of the steering committee, which was the overall committee that broke down into subcommittees. I oversaw the social emotional learning subcommittee of that bigger committee. One of the participants on our team was Anna Wood, who is immediate past president to PTAC. We worked on a grant application that she was kind enough to bring to our attention to, really bring parents into all of our social emotional learning initiatives moving forward. It is an area we're excited about. It's an opportunity where we're going to be able to, reach out to students and engage families more. And it's going to be a major focus of the 2021 school year.
Thank you, Rob. You ready for the last one for a bit, and I'll give you a break?
Sure.
Okay. How are you planning on addressing, tackling the question of whether or not a student might have regressed during the past few months of distance learning?
Whether or not a student might have regressed?
Yes.
What we talked about in terms of the SEL committee, or part of our re-engagement plan, is we identified some data points that we're going to look at, the student's performance prior to the closure, and then during the closure, to see what that gap is. And that's going to be part of that, is going to be your school-based teams, which is going to include your administrators, your teachers, your counselors, if you're a middle school or high school student, psych, social workers, anybody who was part of that student support team prior to the COVID-19 closure. And parents are going to be tied into this whole thing. So thank you.
Colleen, I'd like to just come on that one, because I think. Thank you. This is really a question about all students, and I will tell you that this is a conversation that has been part of our work with the teachers. It'll be part of our, that we met this summer. It'll be part of our work with the teachers that begin the school year. We have made, we are setting expectations for what students should know and be able to do. We have those existing. We are going to build this into the work the days we spend at the beginning of the school year getting to know students, and I by that I mean both, whether it's through remote learning or it's in-person instruction. We are committed to spending time collectively together as a community, and in the course of that community, teachers will build understanding of where students are with their academic skills as well, and then begin to move towards any remediation services that are needed. And differentiate the learning that all students deserve. So that will be inherent in the reopening process, as I said, and I want people to keep this in mind, whether it is together, physically together, or through remote learning, this is going to happen.
Thank you. I think that there are a couple of points that just need to be clarified for people at this point. And the first one, this could sort of be a lightning round. Is distance learning an option for all students at this point?
Yes.
What is the situation with class sizes? Are class sizes being changed at all physically in school?
Class sizes, it all depends again on the, I go back to that survey data, which told us that at 20% of the people, and this was a few weeks ago now we asked this question, but 20% of the families in general across the school district identified that given the choice, they would opt for remote learning. So if we take that at its face value right now, 5 out of, I'm going to do the math, right? 20% of our kids are not going to be coming back to school. That will potentially reduce class sizes. I'm going to give you an example of a third grade classroom at one of our buildings. So there's 3 sections of 20 students at that school. And if 6 of those kids decide that they're not coming back, but 5 of them are in one of the one of the classrooms, we're going to have to take a look at that class makeup and redistribute those students across the 3 classrooms. So it's be just a matter of simply subtraction. There'll be subtraction and redivision of the numbers left so that we can reduce the class sizes equally across those sections, and then in order to best improve social distancing in the classroom. So we'll know more about this when the survey and parent responses start coming in about a week.
Thank you. What is the status with the school calendar?
The school calendar will be reviewed at the Board of Education on the Tuesday, August 4th meeting. We have been given that latitude by the State Board of Education to add 3 days to the beginning of the school year to help better prepare our students and staff for reentry. We are looking at that. We are looking at some days that how we might approach that, but we definitely want to take advantage of that opportunity. We have professional learning that has to take place, as has already been mentioned tonight, and we have a lot of planning to do as part of the reentry. The logistics alone, the assurances we need to give our staff and our students, and we're hoping that as part of that reentry, as part of those opening days of the school year before school officially begins, we'll be able to bring students in for essentially a trial run, those who are coming back to school, and have them experience a shortened day so that prior to coming back, they've got some acquaintance with what school will look like, what their classes will look like. They'll get to know their teachers, and they'll have some understanding of the expectations for social distancing, mask wearing, those types of things.
Thank you. And then the last lightning round question, it's less of a lightning round question, and I think, Mike, you could answer it, or perhaps Zakiyah or James might want to take a stab as well. There is confusion around the 10 days of switching between distance learning and in person and vice versa. So how is that going to work? If someone has to be home because they're quarantined, are they going to be able to participate in distance learning? If someone is coming back because they were quarantined or they had previously can someone switch back and forth? And if they do come back, are they going to be assigned the same teacher they might have had before? What are some of the logistics there?
So in terms of being able to come back in the event a student is participating in in-person learning and has to go into quarantine, thus has to be moved into remote learning, we're saying up to 10 instructional days, but obviously we want to ensure that that transition is as smooth as possible for that student. So in that case, it would move a lot faster because we're not worried about balancing of cohorts and exposing of students that hadn't previously been introduced to that person coming into that cohort that had been in existence for a period of time. So when you're talking about going from in-person to remote, that would happen much quicker than the 10 instructional days. On the flip side, the reason we're saying that up to 10 instructional days is because we do have to make some adjustments depending on how many students are coming in at a given point in time, what room is actually available within that particular grade or class that we're talking about on a high school level, and make some adjustments accordingly in order to ensure that the student coming back into in-person learning actually has space in whatever class or grade level that they are returning to. So we're saying up to 10 instructional days. It may be quicker than that. Definitely when we're talking about the reverse going back or into remote from in-person, it is a situation where it would happen quicker than the 10 instructional days. In terms of if they would have the same teacher, if they had to go back and forth, that we can't guarantee that would happen, just because we have other students that may also be transitioning back to in-person learning. And so we will make every effort to try to create the least disruption in the student schedule as possible, but we aren't simply able to guarantee that they would have the exact same teacher just because we are doing that balancing of cohorts as students have to move in and out of in-person and remote learning.
I just want to follow up on a couple things there that Dr. Parish mentioned. On that immediate point, I know we're thinking about individual children moving in and out, but one of the things that two things drove that 10-day window. One was the possibility that multiple students may want to come back at any one time, and the ability of a school to safely and carefully transition students either into remote learning or back into the classroom. So we wanted to make sure that this wasn't a process that we were, going back to the social emotional learning pieces that Mr. Mancusi mentioned, that we were mindful of those things in making the transition. The other part of that is having students kind of complete the work that they're working on in whichever environment they're in. So we're trying to not interrupt the learning as much as possible. One other point I want to make about remote learning here. I'll go back to my third grade example. If we bring together a group of third graders from different schools to comprise a remote learning third grade classroom, and again, to follow up on Dr. Zakiyah's mention of this, remote learning academy, they will act as a class. So I don't want anybody to think or have the impression that there will be individual interactions with teachers, but they won't be necessarily interacting with each other. Going back to the lessons we learned from remote learning in the spring, our effort will be to create classroom environments virtually where those students will be part of a class. And they may be grouped with students who they normally wouldn't be with in an in-person environment, but it will be a classroom environment for them. So I just want to make sure that you understand that and that's clear. I think that point might be getting lost in this conversation.
I think it looks to me like on the chat, the other point that's getting lost, and we only have about 10 minutes left. So this might be something that we have to follow up on as an executive team after this meeting, is that the impression that parents are getting is that distance learning is being discouraged by us. That it's the less appealing option, that there's less thought put into the instruction that will be done that way. And that the shuffling of students around to different teachers is because they are an afterthought. And I think that we can probably touch on that quickly, but the other piece is that people are looking for much more specific information than we can probably give tonight about what a day or a week of distance learning might look like for students.
I will answer that. I want everybody to know that that is not the case. I think that the remote learning, well, if we go back to the plan, and if you think about what it says about students in who are coming into class and being part of in-person instruction, I had a conversation with a couple of other parents earlier this week that felt that we were discouraging in-person learning given all the constraints that go around cohorting, social distancing, masks, and all those other pieces. Neither of those, we're not trying to discourage one or the other. Each of them has benefits, and each of them has some liabilities. Nothing is a substitute for the classrooms we left back in March. So I just want you to be aware of that. I want to go back to something I said earlier. We have spent the majority of our time working to improve the remote learning model. We asked those questions of you back in May because we wanted to take a hard look at how we could improve, and I believe we've done that. We've not put those ideas into practice. We will do that as soon as the school year begins. And as we do that, we will continue to revise those ideas and make them better even still. But we fully respect the decision that parents make and the situation that parents find themselves in making this decision. And we, in both environments, and if we add the third, the hybrid environment, in every environment, we're committing to giving your kids the absolute best education. There's no way I can tell you that it's going to be smooth sailing all the way out, but we are absolutely committed to that as an outcome. And so please know that. And as I said earlier, Dr. Zavichentik mentioned the amount of work that went into the remote learning plans from each of the level groups was immense, and it was really good. And it was so good that it overwhelmed us in the preparation of getting the actual remote learning, the reopening plan out last Friday to you. So now our attention is turned to getting that back to you so that you can see. And I think when we will work as hard as possible to get that out as quickly as possible so that before you ask to make a decision in another week, you'll have a better understanding of what that looks like.
Thank you. There are some questions, Mike, about next steps at this point. Very good one. What's happening with the survey? How are these decisions going to be made? If we are looking at September 7th, I think, start date, how is all of this going to fall into place before then?
Well, I'm looking for any ideas that people have to share. I will tell you that every day I get another email from the state, and the superintendents get an email from the state, and every day it comes around 5:30, 6 o'clock, and I kind of dread opening them at this point. So we are being responsive to the information we get from the state. We will continue to do so. That's one factor. The other, of course, most important factor is the health data that's occurring in the state. Our work with the town health department and our collaboration with them as they learn more will be part of the decision-making process. We are at a place right now where the information we have, you have, if all things were equal and we were able to proceed without further interruption, as it were, we would be working to totally refine the pieces that are in place and strengthen them and add in any missing pieces, respond to all the questions and concerns you have, and continue to make it better. We have every intent to do that, but we also recognize that conditions on the ground will be changing, and we're going to have to respond to those changes as well. So the next step is basically to continually update our plan for you, share that information with you, get communication out to you whenever we have new information to share, invite your questions, and respond to those as quickly as possible, and really go forward into the next month fully prepared to make the necessary changes that I just think are going to come, and what that might look like.
I think the last point, Mike, that I've seen in the chat is that people they haven't heard explicitly that there will be synchronous instruction, that there will be live video, that there would be, these are certain elements that I think some people felt were missing from their child's experience in the spring. And so I think in looking to make their decision or looking for information to make this decision, is that the expectation going into distance learning in the fall?
Yeah. Mr. McCusey addressed this a little bit or a lot, but let me be most explicit. We have every expectation, and we've made clear to our staff that live video will be part of synchronous instruction. I will tell you that going back to the conversation though about why we don't put a camera in people's rooms and just kind of live stream a classroom. I come from a place that live video is absolutely essential for students connecting to school, for teachers to have an understanding of what students need to know and learn to be able to do. In examples of remote learning or even in hybrid learning, any instructional strategy used exclusively is not a good idea. So going back to the idea of just live streaming classroom video all the time, that would be as bad as if a teacher stood in front of a class for 80 minutes and lectured. It's not going to be good for student learning. Our advice and our expectation for teachers is that live video fulfill a purpose in instruction and the instructional outcomes of the lesson. It's going to probably be best served in smaller doses for whole class. And these are not commandments, that I'm saying. These are just kind of guiding principles. So smaller doses for whole class, longer opportunities for small group and individual instruction is going to be how it does and how it's going to work best. But it is absolutely part of our plan and expectations going forward. And please know that's 100% commitment from the Fairfield Public Schools.
Okay. We're just about out of time, Mike. So do you have any closing words, or if anyone else does?
I just want to first of all echo something that Dr. Yoon said earlier at the beginning. We have been working with the Fairfield Health Department throughout the year. We benefit greatly from their expertise, their advice, and we will continue to work with them. As Dr. Yoon said, as much as we prepare for the different instructional learning models, ultimately what's going to guide our decision is the health data. That is not a negotiable. That is something that we're going to have to be responsive to and do, depending on what that data tells us to do. So I just want people to know that, as it did in March, it will guide our decisions throughout the 2021 school year. The other thing I'd add is, while some of the details are still being worked on, everything we're doing is focused on providing the best educational opportunity for your students, for your kids. So we get there from knowing what good instructional practice is, but also gathering your input and information and the input and information from our teachers. So that remains the commitment. And while other things may kind of come in and come out, that focus remains singular and committed to. So I want you to know that. And we miss being with kids. We miss being with each other as colleagues, and we strive every day to get back as quickly as possible to the learning environments that we know are best for ourselves and for our children. So if needed, we will hold other of these opportunities during the August and possibly into the school year, if they're beneficial to you and as more information comes forward. And I appreciate your involvement, your attention tonight. Thank you.
Thank you all. Good night.